local lead generation. We're here with Mr. Dr. John Pidutti of Springs Eternal Natural Health Clinic in Vancouver. How are you doing today, Dr. John?
Good, Mark. Thanks for having me.
So we're going to talk about pain relief. So why do you focus on helping people in pain?
I love helping people with pain. And I think ultimately the reason I love helping people with pain is there's this moment where someone's in pain and then they get out, and to see that freedom they experience, there's a lot of joy and excitement in that moment. And I think I love that experience. And part of why I love that experience is I had several injuries myself that were really painful. And so I experienced all the pain, the difficulties that come with that. And then I got treatments, and the treatments that worked, the pain relief I got, I just loved that experience. So I wanted to share that with people. And so I studied all those techniques that I could, and then want to pass that on. And then lastly, when someone's in a complex pain pattern, it allows me to look at a holistic view. And again, as you may hear, I love looking at the whole person, not just one aspect. I like to see how all the pieces fit together. And when someone's in this chronic complex pain pattern, you have to look at the whole person. You have to look how all these pieces fit together. So it allows me to do what I love to do there then.
So why does the body give us pain, and why does someone get stuck in pain?
Yeah, that's a complex question. And the body, if we really keep it short and simple, the body creates pain, and it's a beautiful reaction to either protect us. So it's a protective mechanism, but it also does it as a way of letting us know of repair. So it tells us about injury, but it also tells us about repair. Most people, when they're in pain, don't want to hear, oh, that's a good thing, your body's healing. But sometimes actually pain is a good thing. It's a sign of that injury is repairing. Why do people get stuck in that? And the problem is, so you have this beautiful mechanism to tell you, don't do this, this is injured, and hey, I'm repairing it. But the problem is it can get stuck in this overreactive hyper signaling that is just the problem. The problem is when it gets overreactive, and that's where you get pain as a problem. Chronic pain is where your body's trying to do its repair and either just hasn't fixed it, or it's done its repair and now your body's stuck in this pattern and it can't get out of it. So ultimately, you just need to reset it. You need to reset, snap it out of that, and that's how you get out of that stuck pattern.
So what do you do to help people get out of pain?
So getting out is again, that's where the complexities come in, because you need to figure out the root cause. Ultimately, you have to figure out what's causing this pain. And with that, there's so many areas you need to piece together. And again, this is where we get that holistic view of looking at all these factors. And for me, I think that's what sets me apart is I love naturopathic medicine because we look at the whole body, and it also gives me an ability to study tools of every field of medicine. And so when you combine all the fields of medicine with the best tools, you don't get stuck in one model. And so some modalities are stuck in, oh, here's the model of you can only treat it this way. And so for me, I just look at, okay, let's look at the whole person, and then let's use modalities or treatments from all over to combine to get the best pain relief. There's ultimately, you need to balance the structure. You need to, if the structural stuff gets balanced, it's amazing. Most pains will go away when that happens. But in the real complex situation, it's way more than just structural. You actually have to look at the biochemistry. Maybe there's a chronic inflammatory issue going on inside, and not, you don't need just anti-inflammatories. You have to figure out a deeper process with that. There's emotions, when you're in pain, that stirs up emotions. And then sometimes emotions can be affecting your healing process. So they throw off the immune system. And then the nerves, we need to just reset the way the nerves are firing. So I think that's it's way more complex. And when you come in the office, we talk more about it, but ultimately you balance those out and your body pulls out of pain.
So can you give us an example of how the treatment looks?
Yeah, so let me give you a holistic example, an example of someone who was in pain where, we didn't just do the structural and it went away like that. Sometimes that's the case, and everybody loves when that happens. But sometimes it's more complex. And so an example was a patient who had shoulder pain, and she had a restricted range of motion. She couldn't lift her arm up. She also had neck pain. And the combo of that, basically, we needed to do some muscle testing. Mark, there's a dog in our neighborhood barking. Can you hear that?
Slightly. Just keep going.
Okay. All right. So she has the shoulder and the neck pain, and we basically figured out the structural issues. Then we did she had been to all kinds of practitioners, by the way. She had seen so many things. So in the end, it's kind of, when that situation's hard, the person's really discouraged, and they're tentative to even do more treatments. So it took a little while to warm her up to the idea, but once we figured out the structural imbalances, and we used a technique called pain neutralization technique, and it just mellowed out some of the pain. Then we use a technique that's called neurotherapy, and that's actually where you inject some natural ingredients with something to just reset the system. Resets the way the nerve's firing, and that pulls people out of pain right away. So that gave enough initial improvement so she could have some trust in the treatments. And then we had to actually look at, there was some things that she was doing internally that was causing a lot of inflammation. We changed that. And then while we do the treatments, if people meet me, you'll know I get you talking, and we talk about the emotional component. It's not something you need to be scared of. It's actually enjoyable to just connect and share what's going on. And so we did all that, and her range of motion came back. She could lift her shoulders without pain, and she's pain-free still.
Awesome. Was there any kind of final takeaways that you had?
Yeah, so to leave people with, the issue is we need to find the root cause of the structural imbalances. And if you can find that, and then we work on the biochemical, we work on the emotional components, not everybody needs all of that, but when you balance all those, the pain goes away. Your body's trying to tell you something, and we just give it what it needs, pain goes away. Then I would say, there's so many different treatments. The treatment is not the key. The key is figuring out what are the root causes and what are the steps you need to take. And then the treatments, if you just put the right one at the right time, it changes things. And hopefully, I guess the last thing to take away would just be, hopefully you're a little inspired to know there's some options. If you're stuck in pain, there's some options out there.
So if you want the option of getting some holistic treatment for your pain anywhere in your musculoskeletal system, these are the guys to call. Give Springs Eternal a call at 604-737-0012, or check out their website, springseternal.com. Thanks, Dr. John.
Thank you. Take care.